Hey everybody, so it is now less than 2 days before my jaw surgery, and my jaw surgery is going to be Monday, October 29th, and I'll be having surgery to correct my underbite. And so yeah, here's where my bite's at right now, which as you can see, it's pretty much open all the way around in the front, and I'll go ahead and show you my profile shots again. And I'll do the other side. So yeah, I have an underbite, and I'll be having upper and lower jaw surgery. On my upper jaw, they're going to cut the bone all the way across the top, and then they're also going to make cuts down here in the bone. So it's going to be a three-piece surgery on the top, and they're going to move it up and then forward 4 millimeters. And then on my lower jaw, they're going to take out a segment of bone on each side, and they're going to move it back 3 millimeters. And then they're also going to correct my crossbite when they're working on my lower jaw. And so yeah, I have less than 2 days now, and I'm getting really excited about it. I can't believe it's here now. And I want to talk a little bit about the supplies that I've bought so far for surgery. So here's what I have so far. I'll go ahead and just show you guys some things. For the first week, it sounds like I'm going to be pretty much on a liquid diet. So I've got 2 different kinds of nutritional drinks right now that I plan on drinking. I've got these, the Special K nutritional drinks, which I've had these before, and they're really good. The only downside is they're only 180 calories, so you don't get as many calories with these. So but these will be a good supplement just for something that tastes a little different. And yeah, these taste really good. I really like them. Then I also have these nutritional drinks, which these actually say that they're for people who want to help gain or maintain their weight, which in the case of jaw surgery, if you're on a liquid diet, I would say this is definitely the kind to get. These have 350 calories in them, so that'll definitely be a good thing to get. So yeah, hopefully these will help me out a lot, which I've had these before too, and I really like them, so it shouldn't be a big deal drinking them next week. And I've got lots of tissues, because from what I've seen in other videos online, it looks like people are constantly have gunk in their mouths that they have to spit out. So definitely have lots of tissues, and I'll probably be carrying this bin around with me, the house, at least for the first week, just in case I need to get sick or anything. I know that's really gross, but it's kind of the reality of jaw surgery, I think. So I'm going to have this bin to carry around with me, and definitely going to have it on the car ride home from the hospital, because I don't know how I'm going to be feeling at that point. I have my water pick, which I know I won't be able to use right away, because I think you run the risk of cutting your sutures open inside your mouth with your water pick, because water picks are pretty powerful. So I won't be using that right away, but at least after a few weeks, maybe it'll help me keep my splint cleaner better, and just keep my teeth cleaner overall. I did get this idea from somebody else on YouTube, was to use this Act mouth rinse sensitive. They said that whenever they were able to finally brush their teeth, that it helped to use this to brush their teeth versus toothpaste, because toothpaste is so thick and it's hard to get off your teeth. So definitely, thanks to that person, I'm gonna try this once I'm able to get a toothbrush in there. I bought several baby toothbrushes, which seems kind of silly to use a toothbrush like this, but I think that's kind of all you're really able to use after jaw surgery from what I hear and what I've seen. So definitely I'll be using these. I've got Carmex, just to keep my lips cleaner and healthier, because I know they'll be pretty dried out after surgery. I've got a nasal aspirator, which I'll have to use to keep my nose clean. They did tell me I wouldn't be able to blow my nose after surgery, because that puts a lot of pressure. If you've had upper jaw surgery, it puts a lot of pressure on the plates and screws, because a lot of them are right there behind your nose. So definitely I'll have to use this. And since the upper jaw surgery does cause a lot of congestion, since your sinuses are up here and they kind of get messed up along the way, so definitely will be using this. And then they also suggested that I use saline spray in my nose, because they give you decongestants, but you can really only use those a couple times a day. But this I can use as much as I need to, just to keep things, just help me get some of the congestion out. And I've got these oral syringes. I got these from the pharmacy, so I'm going to use these to take my medications since it's going to be liquids, and I figured it'd be easier with a syringe. That way I know I'm getting it all in there. I can kind of point it towards the back of my mouth. I've got pillow covers to put on my pillows just in case I've got blood or anything coming out of my mouth, to still keep my pillows a little bit cleaner. I've got a whiteboard to use as a means of communication post-surgery. And I also bought a mirror, which I'll have to use this to sit on the table when I'm trying to eat in the kitchen, just because from what I hear, it does, I'm gonna have a lot of numbness in my lips, so it's gonna be hard when I'm eating to actually get what I'm eating in my mouth without making a big mess. So that's what the mirror's for, and I'll probably still have to use that for a while after surgery, it sounds like. So yeah, those are just a few of the things that I've bought. There's probably other things I've forgotten about and other things I'll need that I'll just figure out along the way, but that's a good start if you're getting ready to have jaw surgery. That's just kind of things I've bought so far. Yeah, I'm really looking forward to surgery. I've just been getting things ready. I've been planning on making a chart so I can track my medications and when I take them. That way I know I've taken everything that I need to take. And I was also going to make a chart up to keep track of my liquids, how many fluid ounces I'm taking in, and how much water I'm taking in, and how many calories I'm taking in, at least for the first week. And I also made a chart to keep track of my weight, because, I've heard, that people lose weight the first week after surgery, but I've also heard that you don't want to lose too much weight because that can kind of hinder the healing process, so I definitely want to keep track of that as well. And yeah, I'm ready to get the surgery over with, at least get the surgery over with and start on the recovery process, and I really can't believe it's here. And yeah, so this will probably be the last time I'll update before surgery, so yeah, if you're watching this, wish me luck. My surgery, it's going to be in 2 days. Right now it's Saturday the 27th, and my surgery is going to be on Monday, October 29th at 8:30 in the morning, and I'm really looking forward to it. And so yeah, wish me luck and check back in later. Thanks.